Hey guys, I don't know if you can hear me. You've got a few laughs there. Hi Janet. Hi Jennifer. Alyssa, hi. Anne, hi. Hi Shweta. How are you guys? Okay, so I think it's about time we start. What we are going to do today, this is the first time Perth Surgical and Bariatrics is coming live on Facebook. We will be talking about weight regain post-sleeve gastrectomy. This was a topic that everybody was popular. Most people wanted me to talk on this, so that's how we chose this topic. So you guys ready? All right, good stuff. Let's go. So all of us know obesity is now a global epidemic, all right? So I found this very interesting slide while I was searching how I could, let you guys know about the impact all over the world about obesity. And I came across this video, which I'll share with you. What this video depicts is the countries all over the world, right? And the number of people that were obese in 2008 with the number of people who are obese in 2012 or 14. And the most amazing thing I found out was that the first country that had more than 30% obese was not Europe, was not in America. It was actually closer to Africa, Saudi Arabia. Can you believe that, right? So 650 million people are actually obese in the world in about 2018. And that is almost 10% of the population in the world we had at the current time, right? So people who have come for my info session will already know about this. First time. Are you guys here? Everything okay? All right, good stuff. Can you hear me properly? Okay, good. So I'm also looking at my laptop there to ensure that I can see your comments. So every time I look that side, just bear with me. So multiple choice question. What is severe obesity? Is it a character disorder? Is it a sin of gluttony and sloth? Or is this a normal physiological response? Can people tell me what it is? Okay, now most of the times everybody will say C, which is the correct answer, but every now and then you've got somebody that says A or B. We do not become obese by simply overeating or for lack of physical exercise, right? People like me, if I don't have the gene that predisposes me to obesity, I can abuse food, I can abuse all the alcohol in the world, but still not become obese. I will get clogged arteries, I'll get type 2 diabetes, I'll get everything else that the obese people get, but won't put on the kilos. However, if you've got a gene that predisposes you to obesity, and if that is triggered by an environmental factor, and that could be anything: brief eating, comfort eating, anxiety, depression, alcohol, oral contraceptive pills, pregnancy, childbirth, you name it. We can go on and on and on with all the triggers that are there in our obesogenic environment now. When this triggers the gene, that's when we become obese, all right? So it's not for lack of exercise, it's not because we overeat, because all of us overeat, okay? All right, so we will now talk about, for people who have just joined us late, we are now going to talk about weight regain after sleeve gastrectomy. Now, why did we choose sleeve gastrectomy? One was because it's popular amongst all you guys. And why is it popular? It's popular because it's the most common procedure done in the world. That's why majority of you who are on this live feed may have had the sleeve, because it is very simple. It's easy for a surgeon to do, and it compares favorably in the short term as well as in the moderate term when you compare the results with the most popular and the gold standard procedure in the world, the Roux-en-Y gastric bypass. Now, why do we compare everything with the Roux-en-Y gastric bypass? Because it's been done for decades. There are millions and millions of cases in the US that have had the Roux-en-Y gastric bypass, so we know what the results are in terms of weight loss, in terms of resolution of all the comorbidities that come with obesity, as well as complications, right? So that's why we measure this. Now, one thing I want you guys to know, that even though we're talking about weight gain after sleeve gastrectomy, most of the causes that I'm discussing with you now also applies for those people who've had the gastric bypass and for those people who may have had the SIPs. Okay, so what is the sleeve? Now, this is the gastric sleeve. This is the area that we surgically remove. This area secretes the hunger hormone ghrelin. So that's why after the operation, people don't feel hungry for about 6 to 9 months, okay? Now, because we've removed such a big area, the brain panics that you're not going to be able to eat and drink properly, and hence sets a neuroendocrinal response. Simplistically speaking, hormonal changes which are relayed through the nerve between the brain and the periphery, and this causes weight loss. So weight loss is not happening because you're eating less, it's because of the hormonal responses, okay? So, the sleeve removes about 80% of the lateral aspect of the stomach. Fine. Now, what does this do? All over the world, any Tom, Dick and Harry does the sleeve in any standard hospital, they will lose 13 to 16 units of BMI. So, for example, if you are a BMI of 40, if I do the sleeve, you should lose or come down to a BMI of 24 to 27. And if that happens, the sleeve's done its job, all right? Or, more commonly, we talk in terms of excess body weight loss. So, you will definitely lose 50 to 70% excess body weight loss when a sleeve is done properly, which means that if you have an excess body weight of about 50 kilograms, you will definitely lose 25 to 35 kilograms, okay? Now, what happens? Most people, at least in my subset of patients, most people lose a lot of weight in the first 3 months. And then they lose a little bit less than a lot in the next 6 months. After 6 months, people start struggling. And then between 9 to 12 months, people would have lost a majority of all the weight that they need to lose and then stabilize. When they stabilize, you put on a few, you lose, you put on a few, you lose. So you're losing 1 kilogram, putting on 1 kilogram. That's the way it settles down until you finally put on 2 to 3 kilograms. That is the sign that the sleeve has now stopped working for you. What does that mean? That it means that it's no longer metabolic active. The hormonal responses have stopped, so you will stop losing weight. If you do this, that means the sleeve has worked and finished, okay? And after a year, you will put on a few more kilograms. Now, this is physiological. This does not mean that you're about to gain a lot of weight. So this is physiological. This happens to every sleeve patient. When they stop losing weight, they'll put on a few, and after a year, they'll put on a couple. So that's why I tell my patients, lose as much as you can, so that when you put on a few, you're still in a happy space. Okay, now, what happens after this? So, all the studies, whatever I'm speaking to you is evidence-based and based on research that has been done all over the world. So when we do the sleeves, we expect 80% to achieve this goal at 2 years. So what is the goal? Losing about 13 to 16 units of your BMI, or losing 50 to 70% excess body weight loss. This is what the sleeve should do. 80% of people achieve this goal at 2 years, which means 20% would have failed, all right? 60% of this 80% of the achievers will still keep this goal at 10 years' time. okay? Which means most of the people who have achieved this weight loss keep this off at 10 years, okay? However, what the sleeve does not guarantee is what you're putting in your mouth. It does not guarantee that you will put good quality food in your mouth or you will eat the right quantity of food. So this is something that you have control of. The sleeve doesn't. So 40% of people amongst that 20% that don't achieve this fail at the 5 to 10 years mark. And these are the people that we will address. These are the people that have weight regain. Out of this, about 30 to 50% come to our clinic and ask for revisional surgeries. Now, I'm just going to take a break and see if there are any questions I can address. Okay, so Fatima, when hormonal process has stopped, what do I do? Follow the 5-finger rule, Fatima. Watch what you put in your mouth. Watch how much you put in your mouth. Exercise 150 minutes a week. You know that you shouldn't be drinking a lot of alcohol. 1 to 2 standard drinks per week is okay, not 1 to 2 standard drinks per day. I'm hungry most of the time. What do? Don't worry about it. Most of the hunger is in the head, right? If you're eating and if you feel full, the satiety portion is working. And if you're still hungry after that, you've got to address the psychological aspects of eating, okay? So this is something where you can discuss that with your surgeon, with your dietitian, and sometimes may be appropriate to seek psychological help. All right, we move on. So what can we do about weight regain? Prevention is better than cure, right? So if I told you there are certain predictors of weight regain and you watched for this and avoided this, then there are chances you may never put the weight that you've lost back on, right? So, surgical factors. Now, it's always the patient's fault. It's always in your head. No. The first thing that we surgeons must acknowledge if things go wrong, is there something that I have done inadequately? Is there something that I have made a mistake on? Now, these usually happen in revisional cases, right? Where you've got a band and the band's been removed and maybe not removed appropriately, may not have been unwrapped, and the surgeon's done a sleeve beyond the band. You've lost 10 to 15 kilograms because the surgery may not have been adequate. And then you go back and people say, oh, it's all in your head, you're feeling hungry, you've got to control it, blah, 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 may not be appropriate. So we've got to look at ourselves within and ensure that we've done the right procedure. Having said that, most surgeons would do that, right? So there are surgical factors, and then we've got behavioral factors, patient factors. It's not always the surgeon's fault. You need to look inwards at what you are doing wrong and assess that. If you've got insights, it's the first steps towards success, okay? Energy consumption and expenditure. So this is very, very important in people who've got the obesity gene. In people who don't have the gene, firstly, they won't become obese because they can eat and drink but still not put on weight, right? So this is very important. If you know that you're predisposed to obesity, you need to keep an eye on how much energy is being consumed and how much you are exercising or working towards expending it. Mood factors. We're all people, we are all humans at the end of the day. We've got a lot of external factors that affect workplace, colleagues, husband, wives, children. We all have issues, and that can affect our mood, which can then lead us to go back to the same old comfort eating, distress eating, and all that kind of stuff. And then lastly, you've got many other factors that can contribute towards weight regain. Okay, so I've got another question here. For those who have weight regain, is it possible to lose it if you don't go back to your old habits. Glenn, hey Glenn, the first question I ask you, mate, is why would people put their weight back on if they haven't gone back to their old habits? That needs to be addressed. So, like I said, it could be surgical factors. If you're doing everything right, and if people are not losing weight, could be surgical factors. There is also the case of genetic resistance, right? We've got a very, very, very rare subset of people that initially will not lose the weight at all to surgery. Thankfully, that subset is very rare. There is another subset where the genetic resistance is high, where you lose weight and then after a period of time, in spite of doing the right thing, you may put the weight back on. Now, this is our new understanding of obesity thanks to Lee Kaplan's study. And that's why it's not a one-size-fits-all. That's why we do not paint everybody with the same brush. That's why when you're young, we need to give you a procedure so that maybe in 20 years' time, if you have regained weight in spite of doing the right thing, then we may have another procedure for you. But you've got to again look inwards and see what you may have done incorrect and then change that before there's a point of no return. Okay? Another question. Tell us how much... Fatima, I think I'll address that in the coming slides, but that's a good question. She asked, tell us how much we need to exercise versus eating. Obviously, the exercise has got to be more than what you eat, okay? All right, so surgical factors. So this is a very, very common question everybody is asking in most of the forums. What is the bougie size that you use? What is the bougie size that you use? Now, a bougie is a simple tube, and it's actually calibrated in French. The most common bougie sizes that I use is between 32 to 40, okay? And what we have found, when we go closer to 40 or beyond, there are certain surgeons, I'm sure not in Australia, but certain surgeons that use 42, 46, 48. When you go beyond 40, the weight loss is less. When you go closer to 32 and less than 32, your ability to eat and drink is severely compromised, and then you can get strictures, inability to eat, and we have to change that. I use a 36 French, and the weight loss that I achieve with my patients is quite satisfactory. So most people, I think, would use a 36 French, all right? Okay, now, we can leave more stomach behind. If you leave more stomach behind, then the weight loss may not be as good. Now, this is something that you find in the category of inadequate surgery, where you would have had a band put in before, and for whatever reason, you know, there must be a small stomach left up inside the chest, which may not have been noticed. And if you sleeve, say if you didn't unwrap the gastric band area where the stomach's been, you know, stitched together. They put a band in and they stitch it. If that is not unwrapped and you sleeve beyond that area, then the weight loss is not going to be adequate. So then that's a surgical factor, more stomach being left behind. However, there are patient factors as well. So a patient could be anatomically very difficult, and that depends on the patient's body habitus. Say, for example, the stomach, if you remember the sleeve, whatever is left behind, if that area is wrapped with a lot of fat, and you think, okay, you're hugging close to the bougie and trying to cut it, and if you don't do that, you leave a larger volume of stomach, and if that larger volume of stomach is more than 40, 42 French, then obviously the weight loss will not be as good. Higher BMI patients, super obese people more than 50, female patients that have a male body habitus, like everything, all the fat is within their abdomen. These are very difficult. The space that we have to operate is very less. Even if we have a lot of gas that is inflated, it is quite difficult. And in these times, you know, again, if you've got a lot of fat wrapped around the stomach, operations can be difficult. And this is the time when we could leave more stomach behind, okay? A young surgeon, as with anything in life, there is a learning curve. So when people start out, it takes them, a minimum of, I think, with the sleeve, definitely about 40, 50 cases to know how to do it properly, to learn about the physiology, the mistakes that you do or treat complications. Even that takes, quite a long period of time. That's why people need to be, going into fellowships, being trained in not only doing the sleeves, the Roux-en-Y's or the SIPs, but also in following up their patients to know what complications and how to treat those. All right. Questions? Are there any interesting questions that you would like me to address? Thank you, Layla. We are having a lot of helpers today. How can you, Fatima, lots of questions from Fatima. How can you get sufficient iron intake through food and also through the multivitamins that we give you? Janet, beautiful question. Pouch reset. This is actually going to address your question. Very good question. Okay, so people talk about, am I going to dilate my sleeve? Is my sleeve going to become bigger? What should I do if I become bigger? And that is the pouch reset or test that you were talking about. Now, some amount of gastric dilation is normal at 6 to 9 months. When we do the operation in the initial instance, the sleeve is very rigid because of the metal staples. It does not allow distension at all. That's why you have that high pressure system of the sleeve. People who've had that operation who feel like shit, somebody is literally pressing on my chest. That's the kind of feeling that they get. That's the high pressure system of the sleeve. Now, at this time, the sleeve won't allow you to eat more than you can, right? That's why if you try to overstuff your sleeve, you will find that you'll have a lot of discomfort and even saliva is not able to go down. So people who've got frothing after the sleeve gastrectomies, mates, you're eating a lot. Stop before you're full, okay? Now, there will be a time, sometime between 6 to 9 months, where you feel, there is a sense of give. What has happened is the staples are treated by the stomach like a bug. So it engulfs it, it tries to kill it. And in doing that, it creates more space. So some amount of give and increase is normal. Don't worry about it. So your sleeve, and this is from studies, there are sleeves which were 150 mils in volume when we started, and at the 9 to 12 month mark, it goes to accommodate 250 mils. So is that bad? No. Is that going to mean that I'm going to put on weight? No. This is normal for you. Stop before you're full. Watch what you're putting in your mouth. Watch the quality of what you're putting in your mouth. You will be fine. This is not a predictor of weight regain. So studies have shown that the initial dilatation of your stomach in the first year does not correlate with weight regain, okay? Which brings us to Janet's question. What is then the pouch test significance of the pouch test? If increase in the size of the stomach does not correlate with weight gain, and if we do this pouch test, how do you interpret it? And we also know that the stomach, sleeve stomach, different food substances of different consistency will fill you differently. So you're given a rice cream, the rice cream test, which is quite popular in Perth, and it fills 250 mils. So what's the interpretation? I don't know. I really don't know the significance. I do not believe in it, and I don't follow. I like to keep things simple, right? So if your stomach allows you a particular amount, stop before you're full and watch the quality of what you put in your mouth. All right, any more questions there? What is the optimal diet after surgery? Now, Jonathan, I don't know if you're my patient, mate. I've got heads that are saying, yes, you are my patient. You would have received a booklet from me, and you would have received a booklet from my dietitian that tells you what is the type of food that you should eat. The best diet is a balanced diet. No matter whether you're sleeved or you're SIP, or you're a normal person who's not had bariatric surgery, a diet that contains the right amount of protein, a diet that contains the right amount of carbs, a diet that contains the right amount of fats and vitamins, fruits and vegetables is a balanced diet. However, we understand that in people who've got bariatric surgery, the size of your pouch will be small. That means you've got to put in how much you require. So you cannot fit the amount of protein that you need through solids. That's why you need to have protein supplementation for the rest of your life. You cannot get all the fruits, vegetables and stuff that you were eating before. That's why you need multivitamins for life. You don't need to have as many calories, thankfully. So the amount of protein you need to eat is more, and the amount of carbs you need to eat is less. However, we all know that if you're not having enough protein, you're not going to lose weight. If you have more protein, no problems. If you have more carbs, you're not going to lose weight. However, if you've got less carbs, you will find that you don't lose weight as well. So the carbs is very tricky. You will discuss this with your dietitian, who will tell you for a sleeve, it's somewhere between 600 and 1,000 calories that you require per day to ensure that you're losing weight, depending on your height, BMI, and all other factors. So this is something that you need to discuss with your dietitian. Apart from diet, what basics do you recommend going back to stop weight regain? Rebecca, if you start gaining weight, you cannot stop it, because remember, you got the gene and then you got the trigger. So if you have triggered your gene again, you're going to go back to the way you're stuffed. Once you start entering into a territory, whether you put on more than 5, 10, 15 kilograms, that's it, end of story. The only option you will have is a revisional surgery, but what you've got to look at is address psychological issues, right? See where you've gone wrong and stop that, because no amount of surgeries will stop you from doing that. We could do a sleeve, you can fail the sleeve. You could do a Roux-en-Y, you can fail the Roux-en-Y. You could do a SIPS, you can fail the SIPS. If we don't watch what we put in our mouth, if we don't watch how much we put in our mouth, the famous grog, if you don't watch how much we put in that, you're definitely a sitting duck for weight regain. Okay, now the behavioral factors. Grazing. So all of us graze, don't we? So we watching a movie, we've got a big bucket, yeah? Big bucket of popcorn, that big Coke, lemonade, whatever. We're sitting on the couch at home watching TV. We are forever grazing on something or the other. So what is grazing? Consumption of small amounts of food over longer periods. This has been found to be the most common cause of weight regain across all studies all over the world, right? So if you want to know what you need to do to stop weight regain, stop grazing. If you feel the need to eat something, grab something healthy, grab a celery, grab a carrot, grab something that is not filled with calories and that is healthy. 42% of people, amongst all the weight regains that they were looking at causes, 42% of people across all studies had grazing, because of which they had weight regain. Now, we can predict which type of people will graze, or we can predict people who graze will have certain attributes. And what are these attributes? They are more likely to suffer from mental issues. People who've got depression, people who've got anxiety, maniac depressive psychosis. These will be the kind of people who will most likely be the ones who graze and get weight regain. What do you need to do to stop this? Make sure you've got psychological help over a prolonged period of time, which stops you from having those mood swings. These are the kind of people that will withdraw from follow-ups. Now, this is very interesting. In my subset of patients, we've got great follow-ups. So most of these people have got great results. So does that extrapolate that people who don't follow up with me will not have as much weight loss, right? The answer may be yes. Maybe they are not coming back to see me because they are having weight regain. Or people who will not follow up with me may have weight regain in the long run. These are the kind of people also that will be less physically active. There was a question, exercise versus eating. People who are less physically active will have a lot of problems with weight regain. Okay? Binge eating, night eating is associated with weight regain. I'll tell you a very interesting story. I had a patient who had severe problems with binge eating. All right? Now, I advised her that she needs to see, I don't get everybody willy-nilly to see psychologists. There are red herrings that we pick up, and binge eating with people in psychological disorders need to see a psychologist before the operation. Now, this patient got very upset with me and said that I don't understand the binge eating disorder and that the sleeve is going to stop her from binge eating. No. Sleeve will restrict the amount of food that you eat, but it does not address the psychological problem because of which you binge eat. And if that psychological problem is not addressed, you will force food through your sleeve and still spoil it, right? So again, the importance of having psychological help in patients who undergo bariatric surgery is quite immense. All right, so energy consumption and expenditure, I think that was again one of the questions, how much eating versus how much exercise. Now, this is a no-brainer, right? The more calories you take, the less weight loss you will have. After the weight loss has stopped, the more calories you take, the more weight you will put on. So most regainers, so again, in the studies across the world, most of the regainers were eating more carbs and fat. Now, these are the two things that give more energy, okay? That's why when people say they are moribund in hospital, they can't eat and drink, we give them what is called as total parenteral nutrition. And the total parenteral nutrition will have a lot, its intralipid was the most famous one. It has a lot of fat because fat gets converted into energy, carbs get converted into energy. So the more carb you eat, the more fat you eat, guess what? You're going to put weight back on. Unhealthy eating habits with a very bad lifestyle. No brainer. You're eating a lot, you're eating bad quality, and no exercise, no going outdoors, sitting in front of your mobile phones, TVs, whatever, all the time and not doing anything. What is the poor body going to do? Put the weight back on. So these are the kind of patients, again, who would discontinue the follow-ups with surgeon and dietitian. So again, this is evidence-based. So all these kind of habits were very common in people who would discontinue follow-ups with surgeon and dietitian. We have a very rigid follow-up protocol in this practice. You know, you guys see me about 3 to 4 times in a year, and again 2 times in the second year, and you see Jane about 5 times in the whole period. So at different spectrums, we try and keep you in the loop so that if there is any habit, bad one, that is creeping in, we can address that. So we have to see 99 patients who are doing extremely well to pick up that one patient that is going to fall under the radar and fail. The seeing 99% patient is worth if we can save one patient from slipping into bad habits. These are also the kind of patients that discontinue daily recording of food intake. I had one patient in my clinic today who was telling me about how she keeps a diary of what she eats, how much she eats, what's the calorie and what's the quality, right? Lots of people start doing this. Once the weight loss is over, everybody gets into a very comfortable area, very comfortable zone, and then they stop doing it. And when people get very comfortable with how they look, how they are, all the compliments you get, blah, 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 out comes the bad habits. Once you lose control, that's when you stop slipping again. Daily recording of food intake, at least a weekly recording of food intake, is a very, very good habit for all people who've had bariatric surgery. Self-monitoring is the most helpful skill in weight maintenance. Do not depend on your surgeons. Do not depend on your psychologists. You take the onus. You be responsible for yourself. You will do well. If you think other people are going to do it for you, you will go back to where you started. This should answer your question, right? If you do physical exercise 150 minutes every week, that's only for cardiovascular fitness. To lose weight, you've got to do 300 minutes every week. I don't know if you guys have the time. I surely don't have 3 minutes to do exercise. Okay? All right, questions. Are there any side effects of surgery? Deepa, that is a good question. Of course, like with surgery, any surgery, there are side effects, and that may be a question that we can address in another one of the Facebook Lives. How can you, as a surgeon, minimize gas pain after surgery? Now, one is a patient perception of gas pain. Most people perceive the high pressure system of the sleeve to be gas pain. People, misinterpret that as discomfort, reflux, gas pain, back pain. The high pressure system is a nerve sensation, and the body equally reacts with it. It's like, if you have an amputation, people still feel they have their leg. It's very similar to that. Each passing minute, each passing hour, it gets better until the body becomes one with it and you don't feel it at all. However, there is a true incidence of gas being left in the abdomen, which can cause irritation of your diaphragm, left shoulder tip pain, and a lot of discomfort. This the surgeon can minimize by using a sucker and sucking all the gas out before he starts suturing the skin. When is SIPS required after a sleeve? Fatima, I hope you never require a SIPS after a sleeve, okay? Sleeve 12 years ago, is SIPS an option? Sharon, yes, definitely an option. But again, you've got to look at what your weight is, what your medical comorbidities. Reflux is the one biggest thing after any operation. When you do a revision, that will decide which way you go towards choosing an operation. More questions. Jenny Lee, will weight gain during pregnancy trigger that gene to pick up weight again? All right. I can't use names in this Facebook Live, but there are about 5 patients in my group, right? 3 of them got pregnant at 6 months. They lost weight for about a month or 2, then they stopped losing weight, and then they had their baby. For 2 months, they still retained all the fluid and everything, and 2 months after delivery, they started losing weight again, and then reached that 50 to 70% excess body weight loss. There was one person who was pregnant on the day of the operation that she didn't know. She didn't tell us anything. She didn't even tell us anything wrong with her menstrual periods. During questioning, we asked about pregnancy. She found out after 2 weeks that she was pregnant. Now we got a neonatologist involved. We had our dietitian take care of this patient. This patient did not lose weight during the pregnancy. For the first 3 months they did, but after that, the baby was growing healthy, had a normal term delivery, and went on to lose weight. 4 is a small number. We need a lot of numbers to say whether this is right or wrong, but we don't want that. We don't want you to get pregnant at least for 18 months after any bariatric surgery operation, because that's when you have the reset point that's hit. So then it becomes easier for you to not only get back to that weight after childbirth, but also to nourish the child inside you properly, okay? I hope this answers your question. Mood factors, I'm going to go very quickly, we're running out of time. Depression, anxiety, stress. If you've got these issues, seek help. Medications used for psychiatric illness. 33% of the causes of obesity is the medications that we take for psychiatric illness. When these people have surgery, if they're on the same medications, they are at a risk of putting their weight on. We discussed with the psychiatrist, we try to change them into medications that don't cause weight gain. However, certain medications, the patient needs to be on and the psychiatrist completely says, no, I can't do this, that's when the option is given to the patient. If they still want to go ahead and risk that, we will offer the operation to them. The other factors that we are talking about, the high cost of good food. If you go to a 7-star restaurant, that is highest, a Michelin star, the cost of anything is supremely high, the quality of food is given is good, and the quantity of good food is given is low, but very low, so it costs a lot of money. That's why we've got the Hungry Jacks, the McDonald's, all of them flourishing. Why? Quick food, cheap, rubbish quality. Follow-up support. Now, every program must have good follow-up, and we know that people who follow up for longer terms succeed in keeping the weight off. Support group. The longer you are in a support group, the longer you are in an obesogenic environment, the longer you keep the weight loss off. We are not going to win the war on obesity by operating on each and every patient. We can't do that. We will win the war on obesity by education, education, education. If you understand this, spread the word. Tell the people, if you are doing this after a bariatric surgery, you will put the weight back on. Moral of the story, Albert Einstein, you will have the same outcome. You've got to change your lifestyle and behavioral attitudes towards eating, drinking, alcohol, and exercise for the rest of your life if you want to keep the weight lost off after bariatric surgery. All right. Any final question that I can take, Suchi? Okay, how long will nausea last after surgery? Katrina, that is very relative. I think most of the nausea is during the first few days after surgery. After about 5-6 days, the nausea should come down. Very rarely, if the nerves have been irritated, you might get nausea for a few more days, but it should not go on for a very long time. Having said that, there have been cases after bariatric surgery where you've got nausea for about 6 months, 9 months and all that kind of stuff, where treatment becomes really, really difficult. There has been no iatrogenic cause, that means surgery-related cause, found for these patients. We treat them with a lot of medications. There are certain medications that do the trick in the US which are not available here, are not approved for use here in Australia. So such patients are quite difficult to treat in Australia. All right, last question. Oh no, this is not a question. I've been asked to vacate rooms. My secretaries need to go home. There is a request from them to please fill a feedback form at the end of this FB Live presentation. It will let me know what you feel about this, and it will also, if you like my page, the open page, this is going to be a continuing affair. We'll try and go FB Live every 2 weeks or so you can suggest what topics you want me to talk about. Massive thanks to Vijay, who has helped me set up this Facebook Live. Thank you, Leila, for staying back and being as good as she always is. Suchi, thank you very much. And thank you to Vivid Pixel for having organized the lighting, the sound, the music. Thank you very much. Have a good evening, guys. Have a great weekend, and I'll see you soon. Bye now.